Ebola is a viral disease caused by the Ebola virus, which results in an acute illness that is usually severe and life-threatening and often results to death in 50 to 90% of cases.
Welcome back to Africa Science Focus, the weekly science and development show from SciDevNet. I am Ogechi Ikianyao. That was Professor Dimi Ogoina, the president of the Nigerian Infectious Disease Society, telling us about the Ebola virus disease, which causes fever, severe bleeding, and organ shutdown. With such severe symptoms, the virus often results in death. Between 2014 and 2016, there was a large outbreak of Ebola in West Africa, and that killed over 11,000 people. It started in Guinea. At the time, the World Health Organization declared the outbreak a public health emergency of international concern because of the risk of international spread. The disease did spread to more countries across the world that mostly contained the virus. But Liberia and Sierra Leone, countries bordering Guinea, struggled to contain the disease and experienced major loss of lives in what was the largest outbreak in history. Since September, Uganda has been battling a new outbreak of the Sudan strain of the virus. This strain does not yet have a vaccine. Our reporter, Michael Kaloki, has been speaking to Dr. Patrick Otim, a health emergency officer in the Acute Events Management Unit at the World Health Organization Regional Office for Africa. Dr. Otim has been telling us about the current outbreak situations in Uganda.
As of the information available from authorities in Uganda and shared with us in the last 24 hours, there were 3 new confirmed cases. That brings the number of confirmed cases to 41. There was 1 new death. Cumulatively, there have been 9 confirmed deaths. However, there is progress being made in terms of the provision of care for the confirmed cases. So in the last 24 hours, we had 2 cases recovering. That brings the number of recoveries to 4. 1 new district was affected, and now we have a total of 5 districts that have had a confirmed case reported from. And cumulatively, 795 contacts are being followed up who have been listed in the course of the investigation over the last 2 weeks. For the current Ebola outbreak, we are managing it according to the principles that we have used in previous outbreaks where we didn't have a vaccine or we didn't have any therapeutic agent. And there are really 5 cardinal pillars. The first pillar is to ensure that we identify the cases quickly. So having a very effective surveillance system that has in it good case investigation and contact tracing. That is a pillar that has been really scaled up in the last 2 weeks to try to ensure that all the cases are identified and their contacts are listed and they are followed up. The second pillar then is in terms of case management. So ensuring that all the cases that are identified are quickly taken to treatment center and they are given the adequate supportive care that they need so that they can be able to survive. The third, which is very, very important, which underpins all the pillars of this response, is the community engagement, because the community is central to the interventions to control an Ebola outbreak. So sitting with the community leaders, answering their questions, guiding them in terms of prevention measures at the community level, passing messages on how they can protect themselves, avoiding large gatherings, avoiding participating in burials of people who have died with symptoms of suggestive of Ebola, and practicing hand washing and maintaining distances in the context of gatherings. So those are interventions that are critical to ensure that we interrupt transmission at the community level. Then the fourth pillar really is infection prevention and control. This is a very highly transmissible disease. It can pass from one person to the other. So we work with health facilities in the 2 categories, those that are seeing cases, the treatment centers, and those where routine care is being provided. So they are being supported to ensure that there is triage, there's adequate hand washing facilities so that normal care can be provided without exposing the patients who are coming to the health facilities to any additional risk. But also then in the treatment centers, ensuring that the healthcare workers are adequately protected so that they do not catch any infection. So infection prevention and control is the fourth and very critical pillar. And then the fifth and last one is in terms of coordination, bringing all these aspects together to ensure that the teams that are responding on ground, they have all the tools that they need to be able to respond effectively. They have all the resources to conduct investigation, to deploy and set up treatment centers in very short time, and really ensure that even people who are being discharged from treatment centers, they have given a supportive package, since most of their supplies could have been decontaminated and destroyed as they were going to the treatment center. So the coordination of the response is very important. That has been a critical aspect of this response.
After the 2014 outbreak, many lessons were learnt about how to manage the Ebola virus disease. We're going back to Professor Ogoina to tell us more about the impact of the 2014 outbreak and how we can use the lessons learned to avoid future outbreaks.
Yes, a number of challenges were faced because of the level of preparedness of the health system. If not that, there was a lot of ownership by the federal and state governments in the response. It would have been difficult because the health system was not necessarily well prepared for the Ebola virus outbreak that occurred, for instance, in Nigeria and indeed other West African countries. One, the port health services were not necessarily prepared, did not have what it took to ensure diagnoses were made at the port level, that's during international travel, and that's why the first case escaped or was not recognized at that portal of entry, which was international health travel, and had to present to a private hospital. The other challenge was that there was the isolation facilities were not available at that time to care for the patients, and they had to make a makeshift isolation facility, then subsequently had to see how they transform another facility to become an isolation facility. So that was also a challenge. The third challenge was that healthcare workers at the beginning of the outbreak were not necessarily willing to participate in case management because of fear of infection, the perception that personal protective equipment were not readily available. But following motivation and communication with the healthcare workers and incentivization, they were able to mobilize healthcare workers specifically for case management. Of course, we had a number of healthcare workers that were field epidemiologists that were involved in surveillance. The third challenge was related to the perception, misconception about Ebola virus disease in West Africa, in Nigeria to be specific. There are a lot of misconceptions about the disease and how it is transmitted and how it's prevented. In fact, what was notorious at that time was people had the false belief that salt with water was a good remedy for Ebola viral disease, and a number of people consumed salt and took their bath with salt. But what health authorities did was to ensure that they advanced their advocacy, risk communication, and community mobilization to dispel these myths and misconceptions, and to ensure that people are very aware about how Ebola virus disease is transmitted and how they could prevent it. There are also challenges of lack of resources because the state governments involved, the federal government did not have sufficient resources, and this is where we, as a country, and I also know that other African countries receive support from partners, international partners, and even private sector players. Got some support from those private sector players. The other challenge that also happened was the fact that contacts of cases, and that was typical of what happened in the Rivers State in the southern part of Nigeria. Contact of cases did not follow instructions of isolation or being quarantined because they were supposed to stay at home, self-isolation. And unfortunately, somebody left Lagos to Port Harcourt and exposed close to 528 persons to the disease. Fortunately, only 2 infections were confirmed, and 1 person unfortunately died in the country. So these are some of the challenges. Of course, there was also the challenge of limited laboratory capacity At that time, there was just one laboratory that had the capacity to do a molecular diagnosis of Ebola virus disease, but the country was able to leverage on that laboratory to ensure that diagnosis was done in country. So these are some of the challenges that were faced by the country and by extension other health systems in West Africa during the 2013-2016 Ebola outbreak.
Professor, what measures do you think need to be put in place to try and avoid future Ebola outbreaks on the continent? Is there something that is being done or can be done at a continental level?
Yeah, so I think it's important that as African countries, we must understand our disease better. If you understand our disease better, then we don't walk blindly. And the ways to understand our disease better is through surveillance and research. So we must intensify surveillance efforts to ensure that we are able to diagnose cases early and are able to follow up the contacts of such cases such that we prevent chains of transmissions that might occur. A critical aspect of the surveillance which relates to early diagnosis is to ensure that we have the diagnostic capacity, because in most cases, what we see with some of this outbreak is that because we don't have the sufficient or the needed diagnostic capacity, we are not able to rapidly confirm cases. And so at the time cases are confirmed, there are already chains of transmissions and perhaps patients have already died. So it's very important that we have rapid diagnostic tests available for African countries, such that in the various hospitals and health centers, not necessarily in tertiary centers, there will be capacity for us to make a prompt diagnosis and escalate for confirmatory diagnosis. That's very, very important. I think it's also important that we invest in infection prevention and control, investing to institutionalize infection prevention and control amongst African hospitals. We are seeing cases of where in the Nigerian outbreak, close to 5 to 6 of the 20% that were infected and a few of them that died were actually healthcare workers. And the same thing we are seeing playing out in the current outbreak that's ongoing in Uganda and even in DRC and other outbreaks that have occurred in the West Africa and East African region. And so the healthcare setting should be prioritized to ensure that we protect our healthcare workers with knowledge, the needed knowledge and skills to protect themselves, and also ensure that we provide sufficient quantities of personal protective equipment, because that's always a recurrent challenge when we have outbreaks. Personal protective equipment are not always available to care for cases. That has to be done. It's also important that we invest in research. The area of research that is important is to ensure that we develop therapeutics and vaccines, because ultimately the chain of transmission that results in disease, it's not all situations that we may be able to break that chain. A number of people will develop infection and even develop severe disease. So we must invest in therapeutics and, of course, vaccines. We know that currently there is a vaccine that is available for the Zaire strain, but not for the Sudan strain. And there are therapeutics that have been undergone clinical trials, mainly monoclonal antibodies. But we must invest more in research to uncover many more of therapeutics that will be useful for the management of cases. And the last is the investment in health security. It's important that African countries invest in health security and human resources that is required to address outbreak. So we're talking about financial and human resources, because if there's no funding is not sufficient, it becomes very difficult to address or meet most of these things I've stated before now. And if we don't have the expertise with the adequate commitment and motivation to ensure that they deliver on the objectives that have been set out, then it becomes difficult for us to make any progress.
That's all from us at Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hurst, with reporting by Michael Kaloki and editing and hosting by Ogechi Ekeanyao. Until next time, goodbye. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station.